All right, Rick. So low back pain for about 2 months. It's about 7 out of 10 happening about 75% of the time, and also the left knee's bothering you quite a bit.
Yes, sir.
Okay. It's coming from your work, or what do you think caused the problem?
It probably would be from overusing my body. I would think so. Long days, years of it.
Okay. Have you tried anything else for it to treat it? Any kind of medical intervention?
I just take a couple of Aleve when it really starts rubbing on me. You know, a couple pain relievers of some type, Aleve or Tylenol or whatever I have access to.
Okay. So you need you want to make sure your body's able to continue working. You want to be able to lift things comfortably, and hopefully ride your motorcycle next summer. Is that correct?
Correct. Yes. Okay. It'd be nice to get off it after a nice 6-summer ride and not have back pain.
Yeah. Okay. All right, great. Well, let's see how your posture looks.
Okay.
So then I'm going to have you come stand on the platform. Yep. Yeah, you can see your pelvis is shifted to the right. And is the back pain something that you normally feel even before the last 2 months?
Yeah, oh yeah. Yeah, it's been going on, you know, I would say, you know, I guess a couple of years, you know, I mean,
Couple of years.
Not bad, but, you know, I mean, I just started noticing it more this summer.
Okay, the summer.
Unusual,
Yeah.
Like I say, then it starts to bother you, and Sue kept telling me,
Yeah.
maybe it's time.
I'll have you take your mask off.
Okay. Maybe it's time, she said.
Yeah.
So, yeah, it's been more so, and that's why I'm here. So
Yeah.
and a little bit of back pain, I think at my age, and
Sure.
physically using my body, I probably can live with.
Yeah.
There again, I probably told you I'm kind of like pain tolerant.
Yeah,
so,
yeah,
you
sure.
know, I can hurt myself at work and, you know, struggle through it. But,
Yeah.
it's just that sometimes it's that severe pain, you know, where it's
Yeah.
just achy
Yeah.
all the time. So if we can get rid of that,
Oh yeah.
that'd be great.
We'll get rid of it. I'll have you just leave that down.
Okay.
Yeah, sometimes it creates a little shadow.
Okay.
So.
I mean, I'm sure that what you see in me, and I mean, it's probably been going on for years, right?
Mhm.
I mean,
Oh, yeah.
just-
Oh yeah, absolutely.
I totally get that. I mean, nothing just comes overnight.
No.
You know?
Exactly. All right, so here's Rick's x-rays. You can see he had about 2 degrees of atlas laterality, almost 2 degrees of head tilt. That's that number over here. Angular rotation, 2 degrees, almost 2 degrees of lower angle because the plane line's not much there. Okay, so with the supine posture evaluation, leg check, you can see his left leg is contracted. It looks shorter. It's not actually shorter if you measured it. The bones are the same length. The muscles are contracted, drawing the left up. And that's probably a good 3/8 of an inch. And if the feet they have an ankle injury, you can also check the top of the ankles. You can check the knees. And I was just talking to Rick, you can feel that muscle is contracted in there. So when we get his body in alignment, get that pressure off the brainstem, all these muscles will relax. And he carries a lot more, almost 40 pounds more on one leg. So we won't be surprised if his knees, ankles, hips hurt temporarily, even though they used to not, because that's going to be a very large load change as he moves through gravity and alignment. Good. You want to get the whole spine nice and centered and relaxed. You know how to position the head off the x-ray. He wants a sharp headpiece, but you don't want to over tilt it because then that can lock up the spine. So you want to keep it nice and relaxed. That's about perfect for him. Pretty darn centered. Good. Contact point we get from the x-ray as well. It's really important because normally we adjust people right here, but his is way down there. That's why knowing the contact point is really important, or else you think you're adjusting atlas and you're on C3 or you're on the occiput. Okay. So if you sit up.
Okay.
And on your back. Slide down just a bit. Slide down towards me just a little bit.
Okay.
Yes. Beautiful.
Felt something cracking.
Did you feel stuff cracking? Yes. Lots of times you'll feel the joints as popping as the body moves.
Yeah.
Wow, this is so much more relaxed.
Oh yeah, I can see that. That's great.
Good. So we'll have you rest now for a little bit, and then we'll check your posture and take an X-ray. All right. So you can see Rick here. His legs are now balanced. Took a while, and you can feel the leg is more relaxed. How does the back feel right now?
Feels good.
How does it, when you move, is there any?
Nope. Feels no pain. Can still feel that in my legs. That's awesome.
Awesome. We can't see the disc. You can see you definitely have some arthritis and degeneration. Your alignment's much better. So this is where you were when you started.
Okay.
So you had about 1.5 degrees here of angular rotation, lower angle, and about 3/4 degree of head tilt. Now your head is perfectly centered. Your lower neck is just about perfectly centered. So you are in pretty much perfect alignment. So your body's in alignment. Looks really good. So now we just got to keep it there. So we're going to check you regularly, make sure it holds. We'll do some other supportive adjustments and soft tissue work to help the body uncoil. And then when it goes out again, and usually stress or fatigue are the most common reasons that it goes out.
Okay.
So, you know, I know your work's physical, so if you can, over your lunch break, take 20 minutes, just get out of gravity, rest a little bit. That will help your body hold.
Okay.
And then just try to get a good night's sleep.
Right.
But fatigue and stress are usually the biggest reasons people lose their alignment in the beginning. But any kind of a fall could do it too, of course.
Right.
And then in here, there's just a few things you want to avoid. Never sleep on your belly.
Okay.
Never pin a phone between your head and your shoulder. Never sleep in a sitting position. If you do have to sleep sitting, support your head. Don't have it kinked over.
I never do. I do sleep a lot on my side.
That's fine. That's great.
Only because of wife will nudge me, I snore a little bit.
Yeah, that's fine.
Only if I have one too many Friday night cocktails.
That's okay. Never use your head as a lever. So if you're not in your bed or you're doing sit-ups or something, never whip with your head.
Okay.
More an issue for women usually, but if you go to a hair salon, don't tip your head way back. If they wash your hair, keep the head up.
Great.
Other than that, lots of just rest, and you're gonna do really well. That's a really good correction, Rick. So,
okay. So like on those X-rays, just not to cut into you, but so
yeah.
I mean, you don't see anything that So yeah, discs are a whole different.
You can see some. You definitely wear and tear there. A lot of degeneration and arthritis.
Okay.
That's the neck, though.
Gotcha. Yeah.
And that's not causing you pain. So.
But it does not. Yeah, I don't typically.
And there's not a definitive correlation between arthritis and pain. You can see some growth there. So there's probably some wear and tear in the disc in these areas, but we can't see them on X-ray, so you can't say so definitively. But if the disc was the problem, you'd have severe, like laser pain down the leg. Probably.
That's what I thought. I mean, from other people,
it would be probably unrelenting constantly if the disc was on a nerve, creating pain.
Okay.
And this, now that you're centered, that's just going to help your body heal, and it'll help keep. We can't take away what's there, but it'll help keep the discs as healthy as they can be, so the arthritis won't get worse.
Okay, makes sense.